Hello, my name is Susan Khan and I'm an occupational therapy student working within the Pulvertaft hand unit within Derby. As an occupational therapy student, my role within the team is to help people resume hand function and to get back to the day-to-day activities they need and want to do. Part of my role is also to assist in the treatment of long-term conditions such as osteoarthritis of the base of the thumb. In this video, I will talk about what is osteoarthritis and some of the different types of splints used within the treatment of your condition. According to Arthritis Research UK, osteoarthritis is a degenerative condition where the cartilage that covers the surface area of the bone becomes damaged. In a healthy joint, the end of our bones are surrounded by a shiny substance called articular cartilage. This cartilage acts like a shock absorber for our joints and also creates a smooth surface which helps our bones to glide. Each joint is protected by a fluid-filled capsule and is stabilised by ligaments. Over time, mechanical forces may lead to the wear and tear of the joint, which may lead to osteoarthritis. As the condition progresses, the cartilage may begin to thin and coarsen, leading to the narrowing of the joint space and bone-on-bone contact, making the joint painful, stiff and more difficult to move. Over a period of time, the body may react by trying to repair itself. This can result in the creation of bony spurs, distorting the shape of the joints. This X-ray shows a picture of a normal hand on the left, whilst the picture on the right-hand side shows a hand with osteoarthritis. In the right-hand picture, you can see the narrowing of the joint space at the base of the thumb, and bony growths can clearly be seen on the finger joints. Osteoarthritis of the base of the thumb. Osteoarthritis may commonly first appear within the joint at the base of the thumb. A reason for this is that the joint is estimated to do as much as 40 to 60% of all work carried out by the hand. The joint at the base of the thumb is very versatile. It enables us to go from the most delicate of pinch to the most powerful of grips, and allows us to move our thumb in and out, forwards and backwards, and to touch our fingertips. These actions help us to use our hand effectively to participate in the activities of our daily lives. Common symptoms of osteoarthritis to the base of the thumb may include swelling and stiffness around the joint, reduced pinch and grip strength, muscle weakness and instability of the joint, and pain. When discussing pain, it is important to realise that as individuals we all have different tolerances to pain. Your osteoarthritis pain may worsen after activity and may be relieved with rest. In more severe cases of osteoarthritis, pain may also occur during periods of rest. Splints. Splints are commonly used in the treatment of osteoarthritis. They can be used to rest the hand or support the hand in doing work. Evidence shows that splinting can have a positive impact on the reduction of pain and lead to an increase in pinch and grip strength. Splints are an important non-surgical treatment as part of managing the condition alongside use of anti-inflammatory medications, exercises for the hand and modification of everyday tasks. They come in many different shapes and sizes and materials, and they have different jobs. They may include support at the wrist and base of the thumb and the knuckle joint of the thumb. Your therapist may fit you with a ready-made splint, which is usually made from a soft fabric material. However, should your joints require more support, your therapist may choose to custom make a splint from a special mouldable plastic material. Additionally, you can even be given several splints, each with a different job, to be worn at specific times of the day to support you with specific activities. Your therapist will assess and discuss with you which type may be most useful for you. Comfort may also influence your splint choice. Resting splints. Resting splints are commonly worn at night, but your therapist may also suggest that you wear them during the daytime should you have a flare-up of osteoarthritis symptoms. Wearing a resting splint can support the hand and thumb in a good position, leading to the reduction in pain, and can also help you with reducing morning stiffness and swelling. The wrist thumb brace is an example of a resting splint that may be provided to limit movement and enforce the resting of the thumb joint. The splint has a wrist and thumb support incorporated into its design. To put on the splint, firstly undo the straps. Place your hand into the splint, making sure that your palm has contact with the splint. To do up the straps, Start with the strap nearest your elbow. Make sure that the splint is not too tight. You can readjust if necessary. Working splints can reduce wrist and thumb pain by increasing support and stability at the joint, which will help to protect and support your thumb when carrying out your day-to-day activities, as well as helping you to increase your grip strength. However, you may feel that you have less flexibility at the joint whilst wearing the splint. This is because they hug the joint firmly. Working splints are usually removed for rest, sleep, exercises of the hand and bathing. An example of a working splint is the T restriction splint. This fabric splint incorporates support at the base of the thumb joint and wrist, offering protection during activities of daily living. It has a strap that wraps around the base of your thumb and through the web space. To put on the splint, firstly, put your thumb through the support, doing up the Velcro on the back of the hand first. Take the thinner strap and wrap it round the palm of your hand, through the web space and secure on the back of your hand. Make sure that the splint is well fitted and not too tight. You can readjust if necessary. On a cautionary note, splints should be worn as directed by your therapist. Constant wearing of splints may cause joints to stiffen up and in the long term may lead to the weakening of the surrounding muscle structure. When you take the splint off, you may do some gentle exercises to stop the joint from stiffening up. Your therapist can advise you on this. Should wearing of the splint create redness, numbness, tingling, swelling, discomfort or pain, you should seek the advice of your therapist. In caring for your splints, remember it's best to hand wash your splints, and splints should not be dried in the tumble dryer as this may distort the shape of the splint. The wearing of splints is just one treatment in the management of osteoarthritis. Thank you for watching the video. I hope that this helped with your understanding of osteoarthritis and the use of splints. For more information, please go to www.pulvertafthandcentre.org.uk.